right, we've got a very special guest here with us today. Meg, welcome to the Deep Life podcast.
Thank you so much for having me, guys. I'm so excited to be here.
We're thrilled too. And I think that this, if anything, we're going to get very deep into a lot of serious subjects. So I do want to forewarn our listeners that if any of these topics that we're going to cover are triggering to you, please shut the podcast off, because Meg is a therapist and we're going to get into suicide and trauma and a lot of things that can be very sensitive subjects. But before we dive into all of that, can you give our listeners a little background on who Meg is and how you got to where you are today and what you do?
Absolutely. So I am a licensed professional counselor and a nationally certified counselor. I've been in the field now since about, 2015. So to get started, from high school, I always knew that I always wanted to do something meaningful with my life. I didn't really know exactly what that looked like, but I always had a passion for mental health. I think it touched me personally. I've seen it touch other people. And once I got to college, I declared my major in psychology. So I got a bachelor's degree in psychology with a specialization in forensic psychology. And then I graduated, and I knew that I wanted to go further with that degree, but I didn't know in what capacity yet. So I started working at an autism center. I was doing some administration and marketing there. And then I decided to go and get my master's degree in mental health counseling. And then from there, I went and did my internship in, I primarily worked with adolescents, some adults, and I did substance abuse and co-occurring mental illness. And I did an intensive outpatient group and some outpatient counseling. Then I moved to Georgia. And from there, I worked in inpatient unit, primarily working with children and adolescents. And then I moved on to working in a community mental health setting, doing outpatient therapy. And now I'm working in more an administrative capacity. So I'm a clinical director. I've also been an operations manager. So now I oversee a group of fabulous therapists. I'm not in active practice now, but kind of left that capacity. And now I'm doing more of a leadership role. So I've done a number of different things: substance abuse, mental illness, developmental disabilities, autism spectrum disorder, you name it. So the agency I'm working for right now, we primarily serve probably 99% of the clients that we serve have been impacted by some form of trauma. So we are a trauma-informed agency. So that's a lot of what I'm seeing right now. So that's a little bit of background on me and what I do and kind of how I got here. And yeah.
I think that's great. And I think that there's so much that we're going to unpack and kind of dismantle all of what you've been through. I actually just had a question pop in my mind that we actually didn't go over, but I think it's important to touch upon because you're seeing so much mental health issues, substance abuse, traumas that we're going to get into. Mm-hmm. How does this affect you? Because, we like I said, we didn't talk about this as like a question, but I think it's important because Dan and I always have the philosophy, like we can only show up for our clients the best that we can of ourselves. So, how do you take care of yourself and unwind and kind of get yourself into that mental space of either removing yourself when you're dealing with, patients, clients, however that may be in the counseling setting? Like, how do you take care of yourself?
That is a fabulous question. I'm so glad you asked it because I don't think we touch on it enough.
Yeah.
Burnout is one of the leading causes of reasons why clinicians leave the field.
Totally.
Vicarious trauma is real. If I sat here and told you that I did not leave sessions feeling like I had been traumatized just from hearing a client's story, I'd be lying to you. Yeah. Especially when I worked inpatient, that was the hardest because you left work, but you knew that when you went back to work the next day, all of your patients were still going to be there because they were inpatient. They were at the highest level of care you could possibly be at. And I knew that, I'd go to sleep at night and I'd wake up the next morning and I'd go to work and they would be waking up and they would be in the same setting. And like that to me was extremely difficult. Yes. Therapists taking care of themselves is, I'm not going to lie to you, it's not something that we often do well. But it's something that you have to learn. We often joke in the field that going to therapy is like a prerequisite to being a therapist. Yeah. Like you have to actually have either like been to therapy or you're actively in therapy. And it's often recommended that you go to therapy. So when you train to be a therapist, you have to go through clinical supervision, years of clinical supervision before you can become fully licensed to practice independently. And one of the things that I would say every single clinical supervisor I've had ever, like they will always ask, are you in your own therapy? Have you been to therapy before? Because if you've never been to therapy before, it's really hard to actively be a therapist. To be able to put yourself in those shoes is very difficult. Now, to take care of yourself, you really have to figure out your own self-care routine. We talk about self-care 24/7. It's a very, trendy topic and word, but it's real when you're doing this work. Now, whether that's exercise, whether that is, like, I know for me, I had to create my own exercise regimen. I was not great at that for a very long time. It was something that I kind of just put on the back burner. And then once I started doing it, I found that I was able to get a lot more mental clarity. You guys can speak highly to this. But for me, that drastically changed my life. And just making sure that I was doing little things for myself throughout the day, or having like a nighttime routine, being able to wind down at the end of the day, being able to shut my brain off. Yeah. Because one thing you will also hear from a lot of therapists is we are anxious people. We just are. We all, and I think almost every person on the planet is now an anxious person. But therapists are highly anxious people, and we deal with a lot of anxiety in the work that we do. So you have to make sure that you're making that time for yourself. Even if it's just something, like cuddling with my dog who's like over here, and he just brings me like safety and joy. Like you'll catch me just looking over at him because I'm just like, he makes me feel safe. So for me, taking care of myself has been something that over the years, and I think definitely when I left direct practice, was something that I realized I was not doing well. And I'll be honest about that. It was not something that I made time for. I was really burned out. And I was having a lot of vicarious trauma through clients. And I knew that I needed to make a change for myself. And now the therapists that I supervise, I would say when I do their weekly supervision, probably the hottest topic we talk about is, what are you doing for yourself? How are you taking care of yourself? Because I'm hearing you're extremely burned out, and the work becomes your life. And if the work is your life and you don't balance that with something else, it's not sustainable. And we need more therapists in this field, and we need more people to do the work. So we need people to take care of themselves.
Yeah, absolutely.
Yeah, you can't pour from an empty cup.
No, you can't.
I think that no matter what kind of line of work you're in or what your life is like, it's not selfish to take time for yourself, because it allows you to give that much more. And I think it's so important.
Yep, absolutely.
You touched on the trauma, which I think it just makes sense, I feel like, to go here, explain what that is, and kind of get into different forms of trauma and how it can manifest differently.
Sure. So I will say, guys, that probably the number one topic that I've seen while working in this field that doesn't have a one size fits all description is trauma. Trauma is, and you could look it up, you could Google it, you could find what a definition is, but the best way that I could describe it and how I've seen it manifest in people is something that has happened, whether it's small, large, that has impacted a human being. The impact is going to be what you're going to see very differently from person to person. Now, trauma can be a huge life event. It can be loss, grief and loss. It can be sexual abuse, physical abuse, neglect, exploitation. It can be, a natural disaster. It can be, getting, carjacked. It can be your home being flooded. It can be experiencing homelessness. It can be anything. And I think one thing is that it doesn't always have to just be one thing. You can experience a bunch of micro traumas throughout your life. So say you are living in an area of poverty and you have experienced chronic homelessness, or you are a person of color and you've experienced racism your entire life. You are constantly experiencing micro traumas every single day, multiple times a month, multiple times a year, and it's just chronic. You may also see traumatized children that are experiencing vicarious trauma through their parents. So maybe that parent experienced a trauma. They are then experiencing it in their own way. That's then being basically placed onto their children. Yes. So children may have not experienced that direct trauma, but they're experiencing that trauma directly from that person that experienced it. So trauma is the most complex thing you will ever see, you will ever experience. It impacts our biology. It impacts our genetics. It impacts every single thing about the human body, the brain, how we function, how we live. Now, you could be a child and you could have experienced, sexual trauma, and you are 8. Okay, you keep growing and growing and growing, but you essentially are stunted within that 8-year-old body.
Yeah.
I've seen a number of children and adolescents who have come in that, were functioning at what we call, baseline, which is almost like a normal level of functioning for that person. So then they experience a trauma out of nowhere, and they are essentially stunted at that growth. They are essentially stunted at that age. This can happen for adults too.
Yes.
So it impacts not just your mental health, but literally every single piece of the human being.
Yeah, I think that's so interesting. It's something that Dan and I have been really kind of research and dig into over the past couple of years, because we began listening to, the people who we look up to, within the fitness industry, but the fitness industry is so much tied to, the well-being of our body. And what I didn't realize was that there's an emotional age and then your actual age. And you touch upon that. It's like most people, everybody has trauma, like you said. To what degree it varies. It could be like a neglected child who just was told to be quiet and only speak when you're spoken to, or it's an extreme, sexual abuse, like you're saying. But if you're stunted in that, you're not developing because you're stuck in this traumatic instance. And if you don't kind of grow through it, you're not growing emotionally. And I think that is was so mind blowing to me when I found this out years ago. I was like, okay, but it was scary in the fact where, oh my gosh, I definitely have traumas. We both, we all do at a younger age, but what's most empowering is that we're able to work through it. You don't have to be defined by them, right?
You don't have to be defined by them, but a lot of people don't know that they've experienced trauma.
Exactly. Yes, exactly.
So that you just touched on that, which is fascinating, because if you actually take a deep look back at your life, you realize that you have been impacted by some form of trauma, but you have the resiliency factors and the coping strategies as a human to be able to work through that. Now, a lot of people don't have that. They don't have that resiliency piece. They don't have that ability to be able to just move forward with their lives or be able to cope with it in the moment. Now, people often get re-traumatized and then they realize, oh my gosh, this happened to me back at this point in my life, and I've never worked through this, and I need to seek out some help. But many people don't realize that they need that help. They don't realize that they need to work through that trauma. Now, people work through their trauma very differently. Now, you may have somebody that experienced the most, we would consider a severe level of trauma. Let me ask you guys, what would you consider something that's severe?
Ooh, I would say sexual molestation.
Right. So you may have somebody that experienced that at a young age, but they are functioning pretty healthy as an adult. They have a life of their own. They have children. They have a career. They've been able to move past it. Now, you may have somebody else that tell me something that maybe just kind of you would think wouldn't be the biggest thing that would impact somebody traumatically.
Maybe getting in a car accident?
Car accident. Now, you may have somebody that got in a car accident that is struggling. They cannot get out of bed. They are withdrawn. They are isolating themselves, or the fact they see cars going down the street and they completely have, a panic attack on the side of the road. They cannot turn the ignition without, almost feeling like everything is crashing down on them. So you really don't know how it's going to impact somebody. It impacts everybody extremely differently. And that's why trauma is just the most complex piece, I would say, of this field. Because there's no one size fits all. There's no one trauma that impacts everybody. And the re-traumatization piece, the way that your body can basically remind you of these things later on down the line, there may be something that you would think, something specifically would re-traumatize you. It would have, if you say you experience sexual abuse, okay, maybe if somebody touched you, that would traumatize you. Maybe it's not that. Maybe it's a smell. Maybe it's a room. Maybe it's a doorknob. It could be anything that brings you back. It could be a watch. It could be looking at a time. I recently heard of it. Somebody looked at a time on their watch, and it was the same time they had looked at during an event. And now every time they look at that event, it's like, okay, the world is caving in and now I'm back. So there's many different pieces of it. It's so complex.
Yeah.
Do you think would it be fair to say that it's not necessarily the event, but sort of how we process it emotionally?
I think it's very fair to say that. I think it's a multi-layer. It's almost like an onion. It's kind of how I think of trauma. I think it is definitely how we process it. I think it's your protective strategies, your emotional support that you have, your resiliency factors, all of those things. So it's definitely how we process it. And it can be the event in and of itself. I think there's so many different layers, but absolutely, Dan, yes.
Yeah. I'm curious, within, your clinical practice and when you were working with people, was there any difference between like children or young people like speaking more about their trauma versus like older, and when I say older, people in their, 30s, 40s, 50s, like any differentiation between that and like their level of like being vulnerable and open and like, because I feel like the older you get, if you're not processing that information, it's almost like you're putting on so many masks, you're covering it up so much that there's so much hesitancy to actually even go into that traumatic experience because they don't want to relive it. But maybe I'm just wondering if children are at least, younger, they haven't been through the decades of years and they're more open. I'm curious if it's
a great question. And I would say from what I've seen, it's very different based on the individual. I will say the earlier that somebody can start therapy after a trauma is the best thing that you can do. So we start serving clients as of the age of 4 years old with where I'm working right now. But some people start serving clients I've seen as of the age of 2. Now you probably think, how the heck can a 2-year-old be in therapy? Well, the beautiful thing is that there are different types of interventions that you can use with children. It's called, one of them is called play therapy. Now, a lot of that trauma comes out through play therapy. So you have basically use different types of play techniques, strategies, observations, and a lot of that trauma then comes out. Now we use things called like sand tray, where you have like little miniature figures that you can use and children can create their own world within a sand tray. I mean, there's so many amazing things that you can use. Now, I will say you want to be very careful when working with somebody with trauma because it's not up to the therapist to determine when it's that person's time to process the trauma. It's up to the client. Now, with kids, you may run into the situation where they're going to be more open about it. They're going to blurt things out. They're going to come to you and tell you exactly what happened. Or you may have some that will not say a word. Their parents bring them in, they tell them that this happened to their child, and now they want you to fix the problem. But the kid could be in therapy for years and years and years and never speak a word of what that trauma was. And that's not up to us to re-traumatize them. Now, with adults, a lot of times they may come in to process the trauma, but they're very upfront about the fact that I'm not ready to speak about it yet. So then, okay, you still have a lot of things that you can unpack before you actually unpack the trauma. And while you're unpacking the things before the trauma, you are actually unpacking it. You are getting to that point of where you can get there. So it's really dependent on the person. It's really dependent on their experience. I will also say it's really dependent on their support systems, where do they feel safe? I think the safety piece is huge, and it's going to take a really long time for somebody to build that therapeutic, which we'll talk about too in the therapeutic process, but to be able to build that therapeutic relationship with somebody enough to where you feel comfortable exposing that piece of your life to them.
Yeah.
I want to come back a little bit to the play therapy. I think that's really interesting. Because that sounds like, I've actually never heard of this, but just thinking of the place my brain goes is that's probably a natural way as humans develop that we do kind of sort through things. Is like play is like almost like practicing life in a sense. Where if you
make
have
believe.
Really,
literally make believe, yes.
But if you have a kid who maybe something does happen that they repressed, it's probably, I'm assuming, going to stop them from playing in a way that's as free as other kids who haven't gone through that trauma. So do you like, I don't know, I'm just curious, like is it with kids in the playing, does it usually come natural, or is it something that needs to be sort of like coaxed out and helped, or it's always gonna be different with everybody? But I don't
It
know.
depends. So what we typically do is we have a playroom. So you don't just have like one little space where they come and play. So, we create like literally playroom areas where there are doll houses, there are toy kitchens, there are places where they can use puppets. There are, sand trays where they can come and, make their own little sand tray display. There are balls, there are bats, there are things where people may use what we call aggressive play. I mean, you create a space. And what oftentimes therapists will do is when they're introducing a child to the playroom is they will kind of observe. They will let the child go in. They will let them explore, see where they go to, see where they might feel the safest. Now, if you just have a kid where you present them with a truck, that may not really do anything for that kid. But if you give them more options of different things that they can play with, you're going to find that there may be something that they do feel comfortable with. You could even just have like a mat on the floor where they can go and roll around. Some kids take a little while to open up to the idea of going and playing and having somebody there with them. Some are like, I was working with a 4-year-old a couple of years ago, and I remember we would go into the playroom and he would just be like, "You're going to be here with me. You're going to stay here with me." And I'm like, "Yeah, I'm going to play with you if that's okay. Or if you don't want me to play with you, I'm just going to sit over here." And I wanted him to feel comfortable telling me that, like, if he did not want me to engage and play with him, that was okay. That was safe. And then I would kind of just watch him. What we do is we track. So we track different like verbalizations that are coming, different types of themes that you see within the play. And a lot of times that's where a lot of stuff starts emerging. That's where you start finding out a lot of the things that have happened. And it's interesting about play therapy. Sometimes kids come in, you don't know what the trauma was. It's great when they do come in and you do know what happened, but a lot of times we don't know what happened. We need to figure out what happened. And then if you actually track the play appropriately, and it requires a lot of training, play therapy is not something that, therapists should just go and do and think, we're just going to play. And it can be very unsafe. So that's why you need to make sure that there's training involved. But you could unpack and figure out exactly what may have happened to a child years ago or a couple days ago or a couple months ago, just by the themes of their play and the things that are coming, verbally from them. So to answer your question, it can be very different based on the kid. Some kids go in and they just go wild and they love the playroom. They love to play. It's the most amazing thing ever. And then other times it's very intimidating and I'd rather go sit in your office and maybe we'll just grab one thing from the playroom and we'll sit there and kind of fidget with that until we feel maybe a little bit more comfortable actually diving into different options of play.
That's so interesting. Yeah. Well, I mean, like you said, everybody's different. It's all going to come out, whatever trauma that may be. So I kind of want to circle back to that trauma aspect and, what is it about trauma and why does it affect everybody so differently? And what are the different forms that trauma kind of manifests as in different people, like suicide or eating disorders or, attempted suicide or cutting themselves or rage too. I mean, just as simple as, being like extremely rageful. I don't know what short temper. Yeah.
No, absolutely.
That terminology. But if you could kind of dive into those aspects.
And you just named a number of different ways that trauma can manifest itself. So trauma can manifest itself in mood swings, aggression, dysregulated mood, just kind of being like hyper aroused all the time. So like you're kind of constantly on edge. You're constantly feeling like something is going to happen, or you're constantly feeling like your body just needs to be on it. Like, when you feel like you're on edge, like we've all experienced it and you're just like, kind of like you're okay, everything's raising. I'm just like, I can't keep my body calm. Like your body can't get to a state of calm. So just feeling very dysregulated. Suicidal ideation is quite common. Depression, anxiety, extreme fears, insomnia. Psychosomatic symptoms. So a lot of ways like where we don't feel well can actually be due to trauma. So maybe you have chronic headaches, maybe your body hurts all the time. You just feel sick, but you're not actually sick. You go to the doctor and they're like, there's nothing medically wrong with you. Mental health and trauma can actually impact our body in a way that feels like something's medically wrong with us. It's very common to have those psychosomatic symptoms. So literally anything that you can think of could probably be a symptom of some type of trauma. There's not specific things that's the most seen in people. I would say you often see the typical norms of more maybe depression, anxiety, maybe some suicidal ideation, maybe some of those extreme fears, isolative behaviors. But I would say I've seen a lot of those psychosomatic symptoms that I don't think we pay attention enough to.
Absolutely. I think that that's really interesting because Dan and I, over the past, couple of years, as we're becoming, as healthy as we can be, we're also realizing that our bodies are highly intelligent and we don't give them enough credit. And we outsource, for doctors and people in lab coats to tell us what's wrong. Not that they don't have answers a lot of the time, but most of the time we're neglecting our own inner, true self that actually knows what's going on, trying to tell us hey, this situation isn't good.
Yeah, something's wrong.
And I'm not trying to laugh about it. Obviously, I'm just saying.
No, but it's real. We often think, okay, let me go to a doctor and they're going to tell me what's wrong and they're going to fix it and they're going to, smack a label on it. This is what's wrong with you. But okay, what are some other things that might be going on and impacting you? I know for me, when I'm really stressed or something is going on in my life, I know I am heavily impacted by severe headaches. So before I immediately think, what the heck is wrong with me? Do I need to go to a doctor? Okay, is this because you're really stressed? Usually, yes. And then once I get control of that and a handle on that, you notice that your body's able to calm down. Your body's able to feel that alleviation of that symptom. So I think we often don't think enough that it can be caused from emotional, behavioral, mental related concepts. It has to be something that's more medical, where it absolutely can be. Yes, it can be. But are you under severe chronic stress? Are you having extreme depression right now? That might be why your body is hurting you so much, because that's real. It's a real symptom.
Yeah. I think it's really important. Like you said, that you can go to a doctor and they slap a label on it, where with a lot of these symptoms show up and it's if you have the right collection of symptoms, it gets labeled as a specific disease. But like you said, if those symptoms don't match up with something that is already a disease, it's just oh, that's just psychosomatic, you're a hypochondriac, you're making this up. But it's just as real. I think a lot of times the stress and mental issues are going to manifest as dis-ease. And just because there's a name, then it's it gets outsourced and it gets we can keep repressing these emotions because I know what it is and the doctors are going to handle it because they gave me this pill and now I don't feel it. But like Elise said before, if that's your body screaming help, something we need to stop and address something, and you're just numbing those symptoms with a pill, then I feel it's going to just keep coming up in another way.
Yeah. And it doesn't even need to be, I'm sorry, I didn't mean to cut you off.
No,
We're using a doctor and kind of pill reference here, but it doesn't need to be that. It could be alcohol. It could be smoking. It could be food. It doesn't need to be a pill either. Right. That's how creative it's, that's everything.
The example you used, a headache and you just go grab Advil, then you're never wondering where that headache came from or what caused it. Because it probably wasn't a lack of Advil. There's probably something else.
There's
going
always
on.
Advil. There's always going to be Advil there for you. Yeah. So, and I think one thing that I will say that I've seen more of now is just because we're becoming so much more aware of mental health and trauma and those experiences. I've gone to doctors recently and they are talking about it. They are talking about mental health. They are asking those questions. I found a new PCP and I went and they were asking me those questions and I'm I actually have some of those symptoms and I am actually a therapist by trade. So I'm pretty aware of what's going on in my body. But, it's very important for all doctors to be able to, ask those questions, ask those screeners to make sure there isn't something else going on instead of, slapping a pill or a label on it. And I will say that is way more common than maybe what we have seen many, many, many years ago. But there's always going to be that bottle of Advil. There's always going to be something that can fix it. But we often don't think that something like a headache could be a symptom of depression. It's not something that you think of. You think, oh, well, sadness, right? You think, they're just not really around people a lot. They don't really want to do anything anymore. They just kind of feel kind of funky. You don't think that headache, that chronic headache, could be a depressive symptom. So we have to get a little bit more curious in this day and age. And that's why, I always like to go off the kind of realm of curiosity. Okay, so what could this be? I'm curious what that could be. I'm curious why you may feel that way versus it's this, and this, because symptoms are kind of manifesting so differently than how we typically thought they were years ago.
Absolutely. And there are so many different emotions that hit us all differently. And I think that people, I for sure in today's day and age, we numb ourselves so much. No one wants to feel their emotions, but emotions are energy in motion, and we're energetic beings. So if we're not allowing these emotions to either come and go without labeling them, whether they're good or bad, they're just going to stay stuck. And I think that is where a lot of mental health comes from, because no one knows how to process it. So I think that this is a good kind of bridge here, because we touched upon suicide. And I know that this is, again, a very extremely sensitive topic and it's uncomfortable, but if we don't have these conversations, then we're going to be going in Groundhog Day. No one's going to talk about it. No one's going to, bring it up, but I want to dive into this with you because I feel like, and again, I don't know, I'm not speaking from experience other than, removed, but people who either commit suicide or attempt to, I'm assuming, are not wanting to process any type of emotion. They're trying to look for an escape. Would you say that is correct? I would love for you to break this down for us a little bit more, or kind of explain it as well as you can in the instances that you've had with clients and people that you've worked with.
Absolutely. So, and I love that you brought up the fact that we need to talk about this because we don't talk about it enough. Suicide is heavily stigmatized, and there's many people that you will find won't even say the word, or they'll speak it a little bit more quieter, or they'll whisper it. It's not a bad word. It's a real word. It happens every single day. I think the latest data I read is every 11 minutes, somebody has died by suicide.
Wow.
It's the second leading cause of death between, I think, 15 to 24-year-olds. So why aren't we talking about it? Why is it so quiet? Why are we whispering it? We shouldn't be. And I think the stigma is real. And I think I would say the past couple of years, I've seen suicide talked about more frequently. And it's heavily portrayed now in the media. And amongst, I think the way that social media is now, it's quite frequently seen and experienced. And we'll get I kind of want to unpack that a little bit after, but to kind of answer your question as far as what suicide is, I mean, it's different for every person, but essentially it is when that person feels that there's no other way out. There is no other option. They may have experienced and tried other options. They may have been somebody that's been in therapy for years. They may have been somebody that's had chronic suicidality for 15 years. It could have been somebody who is a complete opposite of that, where something negative happened. They thought about it in 2 minutes, made that decision and did it. There is no specifics it can be as little as a couple of minute contemplation to years and years and years and years and years of contemplation. There's no, it could be anything.
Of course,
children, very, very young children, to people. I mean, I think the most common age is people that are 85 and up. So it hits us at all ages from as young. I think I saw something recently about a 4-year-old to somebody that's within their 90s. So it does not discriminate. Suicidal ideation does not discriminate. We see it more commonly amongst maybe different groups. It's more common amongst men. And the most common, and oftentimes that's due to means of lethality. So the most common means are by firearm and by suffocation. So a lot of times men are ones that have more access to firearms, or they have a firearm. but that is the most common means that we do see. And I think the third most common is like poisoning. So taking pills, typically. So the statistics don't lie. The statistics are there. And it's something that we need to talk about more frequently because it's happening. And I think people think if we don't talk about it, it won't happen.
Yeah.
But the thing is that one of the biggest misconceptions I've ever heard, and this is really important for people to hear, is they think if I bring it up to somebody that I think might be suicidal, it's going to make them do it.
Mm-hmm.
Sure.
And that is the farthest thing from the truth. You could actually have just saved a life.
Wow.
You could actually have just saved a life. So if you feel that somebody might be contemplating this or having thoughts of harming themselves, the best thing that you can do is talk about it. The best thing that you can do is bring it to the surface, because by sliding it under a rug, telling somebody all the great reasons why they should be here and all the reasons why their life is so great, you are doing the exact opposite of what they need.
Sure.
Calling it out, bringing it to the room, making it real can actually make somebody feel heard for the first time in their entire life.
Wow. Yeah. That's really powerful to know. Yes. Because I would never have thought that, or really wouldn't have. So it's really, that's amazing to know.
Yeah. And it's scary to talk about. It's not a comfortable thing to talk about. We shy away from it. We shy away from it for a reason. It's terrible. It is. It's sad and it's awful. And we want to do things to change it. Now, this is what we can do to change it. We can talk about it.
Yes.
And people often don't know what they can do, but there's so many different things that you can do, but it's not up to somebody else to save a life. Mm-hmm. And I want people to hear that. I want people to hear that. And that if you think that one of your loved ones is experiencing that, it is not up to you to save their life, but can you help them make the steps to? Yes, you can. Mm-hmm. You can. And when you do know that somebody is contemplating that, and there is, so we oftentimes as clinicians, when we are assessing for suicide, because there's a difference between active suicidal ideation and passive suicidal ideation.
Ooh,
so you'll often see with people that they have passive suicidal ideation, which essentially means that you're having thoughts of wanting to harm yourself, thoughts of death, but there is an intent and there is not a plan. So typically when there's intent and a plan, that's when, you need to act.
Okay.
Now, if somebody's just having the thoughts, it's still extremely serious, but we see it frequently, especially with clients that come in for maybe, some depression. So having those passive suicidal thoughts is frequent. And oftentimes, many people that have experienced that themselves. It's something that a lot of people have experienced. But when there's that active suicidal ideation, which means that there's increased risk. So there is intent to do it, and there's a plan to do it, and there's thoughts to do it. Basically, the trio. Okay, there's no more time to kind of sit and chat. We need to get some help now. We need to figure out what we need to do now. So it's always important for people just to be aware of what resources there are around them. And I just encourage people to know, what are the crisis lines in your state? What are the local hospitals in your state? What are the local inpatient facilities in your state? Where can you help somebody or bring somebody or call? And 911 is always an option. We now have a new line called 988, which is a new line that people can call for mental health related crises. Because 911 has been so flooded for so many years with mental health related problems that now there's a line called 988 that has been rolled out in every single state that people can call. You can call for a loved one. You do not need to have the loved one call themselves. You can absolutely pick up the phone and initiate that crisis call. So I think there's plenty of resources. We just need to actively use them and know that if you do feel like there is an emergency, don't wait.
Yeah.
And you can implement that change immediately.
Yeah, that's so interesting. I find it fascinating that you said, you can't save someone's life, which I know we're specifically talking about suicide in this instance, but just bringing it back to what Dan and I do, we can't save people from their unhealthy habits. They have to be the ones to change. They're just kind of correlating here. But what's interesting, I would love for, if someone is in this situation that they think, a loved one, a friend, a coworker, someone may be experiencing these suicidal tendencies, what does that look like from the outside? If someone's trying to perceive, I'm not even sure what I would look for.
That's a great question. So somebody that might be contemplating it for a while, you may first notice at first that somebody's withdrawn, isolative. The things that used to bring them joy maybe are not bringing them joy. The typical norms of behavior have changed. Like you want to be mindful of a significant behavior change.
Okay.
Now, that kind of helps you understand if somebody might be in that process of contemplation. Once somebody has made the determination that they have decided to actively take their life, what you may see is a sense of relief. You may notice that one day somebody was completely withdrawn. The next day that you were speaking with them, they were happy, excited, and you thought they turned a corner.
Yeah, I was just gonna say, yeah.
And that's the scariest thing, is you think that they turned a corner and this is the case. This is not always the case, but this is just something to be watchful and mindful of.
Sure.
That's oftentimes what people experience when they've decided that they've made that choice for themselves, and they feel that relief that the pain is going to be ending.
Wow.
So you may see that there's different, especially with adults, you may see certain things with like money, bank accounts. With like teenagers, I've seen before, like telling parents not to pay for certain things for college, like don't make that payment. Certain things like that. So you want to be mindful of like financial things. Sometimes, specific things with maybe a will, like random things like that may have been like a really random switch and change from how they were previously, could be an indication that they have made that decision for themselves. Now, I will tell you that a lot of times these decisions are made impulsively. And this is where people are like, how did I not know? You could have never known. Now, sometimes, yes, we have the signs. There is that contemplation period. There is that kind of place where there could have been intervention. But again, it's never anybody's responsibility. But there are frequently times where it's that couple of minute period where that decision is made and then it happens. And now you see all over the media where somebody had, completed suicide and everyone's like, there was no signs. I never knew, had no, like with the celebrities, especially, it's all over the place. We had no idea. They were the happiest person ever. How could we have known? We had no indication of this. And it was a split-minute decision and happened very quickly. And so it is not the most predictable thing, where yes, we can definitely identify the warning signs and what those could be for somebody. Those warning signs may be non-existent for another person.
Sure.
A bad business deal, feel there's no way out of it.
Yeah.
Feel that you've completely destroyed your family and your life and there's no way you can come back from it. So it's while we need to be very mindful of the warning signs, we often don't get the opportunity to catch the warning signs.
Yeah, of course. I think it's really important to shed light, and those are amazing, just little things to look for. Again, like I said, I would have never even thought of it. And I don't think most people do, because it's not talked about, like we said.
Right,
So it's so important to have these types of conversations.
Yeah. I know that obviously everybody's gonna be different, and some people, like you said, it happens really fast, but does there seem to be like a common progression of like maybe somebody goes from like anxiety to depression to like extreme depression and suicidal tendencies, or is it just different with everybody?
It's not the most common thing on the universe for somebody just to wake up actively suicidal. I mean, typically they're, especially, I think what we can say for children and teens, which I think is important to touch on, is there are a number of different risk factors and a number of different progressions that we do see. However, when there is that substantial life event, that extreme stressor, that extreme trauma, that extreme thing that feels like you're never going to get out of, that is where we may not have the ability to see the progression. Now, we may see the progression with somebody starting with depressive symptoms, such as, they maybe start withdrawing, getting a little bit more isolative, feelings of sadness, almost feeling, kind of when you feel just really flat, like you just don't really have a lot in you. There's not really a lot of emotion that you can express. So that may happen for a little bit. And, the things that used to bring you joy don't really bring you joy anymore. You don't really want to do much anymore. Getting out of bed just to go to work is like the hardest thing in the world. And then you're just kind of feeling hopeless. And it's like, what is there for me? It doesn't really feel like there's much for me anymore. I don't really want to be around people. I don't really want to do anything. I don't really find joy in work anymore. Those feelings of hopelessness are extremely important to watch out for.
That makes
Because
sense.
once that hopelessness kicks in, that's when the thoughts are very easily able to start swirling in your brain, because you don't really feel like there's much else for you. There aren't really other options for you. So hopelessness, feelings of worthlessness, not really feeling like you have support and like things are worth it for you anymore. And those are huge pieces. So like, especially when I'm working with clients with depression, I want to really assess for their feelings of hopelessness, because I have found in my practice that is one of the biggest things. Is once those feelings kick in, it's like, okay, where else are the thoughts going? And typically it's like, I don't really feel like I want to be here anymore. Okay, where is that going to go next?
Mhm.
Yeah.
I don't really feel like I have a purpose.
Mm.
I don't really, and then that's kind of how the progression kind of kicks in. Now, intervention is possible during that. And you can also have those feelings of hopelessness and still have passive suicidal ideation, where you don't have active suicidal ideation, or maybe you don't have, an active plan, but it's still very much so just as alarming and needs to be addressed.
Mhm.
Yeah, absolutely. And that makes sense. I feel like this is a great way to tie in, how therapy and counseling may help. It's obviously great for some people. It's not going to help other people, but I think it's much more kind of common these days. I don't know, as opposed to like when I went to therapy in
Yeah,
high school and
me
college.
too.
Yeah. But I feel like even now, like I know people who have children and their kids are in therapy and they're like 8, 9, and 10. And I
Yes.
think that that's incredible, because like you're saying, the younger that you start is going to be as beneficial as it can be. So, break down. I'd actually love to know the difference to this, kind of like a 3-part question, how
Sure.
therapy and counseling can help, specific individuals, whether it is just like literally preventing them from either harming themselves or others, or if it's just allowing them a safe space to talk where they might not have a safe space to talk at home. And also, is there a difference between therapy and counseling?
So good question. So therapy and counseling are, essentially the same thing. So we often get degrees in mental health counseling, and that counseling is the field. Therapy is what is provided, essentially.
Okay, fabulous.
And there's different types of therapy. There's different types of interventions. Now, remind me of your first question, because that was a really great question. I want to make sure I unpack all of that.
Just how it can help people, whether, especially, I don't want to say kids. I just feel like it's so prevalent in the younger generations right now with social media, like the comparison game, what therapy can do for, children and even young adults, either allowing, that safe space, or I don't want to say preventing harm or something, or just,
But it can, though. And I don't mean to cut you
right.
off, but it can. So therapy can be very preventative.
Okay. Yeah.
Therapy is what you make it.
Oh, I actually really love that.
Therapy is what you make it. I think I love to hear kind of what people's perspectives are of therapy before they've actually gone to therapy, because you often see it portrayed so differently on movies and TV and social media, and, somebody lying on a couch, and like, yeah, it can be that way. There's different modalities that you can use where that is how therapy is.
Yeah.
The therapy, in my opinion, in my professional opinion, is therapy is what you make it.
Yeah.
Now, every therapist is different. There is not a single therapist that is the same. Different therapists have different types of treatment techniques that they use. They have different types of approaches that they use. They may have different types of populations that they specialize in. So some people know, like, I am really good with this group of people. This is not my forte. I'm not as helpful with this population. There is not a single therapist that can help everybody. I want to say that therapy is not a one size fits all. You may go to therapy and you may not connect with that person at all. And you think, oh my God, is this therapy? No, there's just other therapists out there. Because
Yeah.
every therapist is different. Now, therapy can be preventative and it can be a safe space to go and talk. Therapy can be extremely goal oriented. Therapy can be, a space where you go and just learn about yourself to then be able to be preventative in different areas of your life. It also depends on the treatment setting that you're in. So if you're in more of kind of like an outpatient counseling, maybe you go to like more of like a private practice, kind of setting, that may be more of a safe space setting for you to go to. That like you're having some stress or you're seeing some things down the line that you want to go and address and kind of make sure that it doesn't get out of hand. That's probably a good setting for that. Now, you may notice that you have pretty significant mental health struggles, or you're experiencing that high level of suicidal ideation. Now, there's going to be different levels of care for that. So there may be more of like an inpatient level of care. There may be something where you have therapy multiple times a week. Now, different states have different levels of care. If you're a child and you're experiencing, severe mental health struggles, or maybe you recently discharged from an inpatient hospital, probably not the most appropriate for you to go to a private practice setting where you're just kind of talking once a week. Maybe you need something more intensive where somebody actually goes to your home and provides you and your family therapy in your home like 3 times a week. That's an option too. So therapy is not just, I'm going to go to somebody's office and sit on a couch and lay back and process, my childhood, or I'm going to go and prevent things that I think might happen badly in my future. It can be somebody comes to you, you meet somebody in the community, for children, they can have therapy in school. Our organization actually goes to children's schools and sees them at school. So therapy has now become this very molded field where we meet the clients where they're at. We meet them where they're at and we get them what they need, dependent on what those needs are. Therapy can be started at any stage. Therapy doesn't have to be started at a specific stage for you to feel like, well, I didn't start then, so why start now? Which I often hear from people of, well, I'm 30 years old now and this happened 15 years ago. And what's the point now? I've already gone this far and I'm doing okay. You can start at any stage. You can start when you're 4 years old. But the thing is too, is that for some parents, I think a lot of parents are very fearful of the world and very fearful of what could happen.
Sure.
That doesn't necessarily mean that your child needs to be in therapy, because there's a lot of age normative behaviors that we often now think are, abnormal. They may not be abnormal. Your kid may just be 6 and may just be a 6-year-old. They may just be kind of playing a little bit aggressively because they're 6. And maybe they just watched something on TV and maybe tomorrow could change. So I think it's important that, yes, anybody can benefit from therapy, but do we need to put a child in therapy that may not necessarily need it now? No, because guess what? They may need it 10 years from now and they're therapied out because they were in therapy before when they didn't really need it. And now they're not going to go to it when they need it.
That's a great point.
That's interesting.
Yeah. Wow. Oh my gosh. I feel like this has been so informative. The information that you have given, is eye-opening to me. And I think that everybody is going to be I'm so gracious for you speaking so candidly too about it. Is there anything that you feel is also very important that like people need to know before we wrap up?
Just be aware.
Yeah.
Be mindful. Be aware of your surroundings and your loved ones and your people. And when you notice a change, don't just let it go unnoticed. And it is never too late to start your journey. And it is never, ever, ever too late to better your mental health, because we can all better our mental health. Even the people that are actually actively in the field can treat their mental health. So it is never too late. And I would just say, like, being more aware and more insightful is probably what I would just like to leave people with.
I think that's beautiful. I think that is what all we can all do is just be more mindful and more aware. Meg, we cannot thank you enough for joining us on The Deep Life. I think we certainly got deep on all of these subjects. So thank you so much. Where can people find you, just in case, or where are there resources that, you'd like to point anyone to, which we could, list in the show notes if there are important, websites or avenues that you direct people to?
I would say for, I think listeners, just in your respective states, do some research, find out what your crisis lines are, find out what the resources are in your local area. If this kind of sparks a thought for you that maybe this would be helpful for somebody, maybe for you, go. I mean, it's very easy these days to find a therapist just from going on Google.
Yeah.
Now, and I encourage you to look up those resources. I encourage you to look up those crisis lines because they're all different in different states, but 988 is our new crisis line across the country. So be aware of that. You don't only have to use 911. 911 is a great resource, but that is available to you. But just do some research. The thing that's really beautiful and wonderful about our internet, while it can be scary at times, is also the fact that you can find so many resources on there now. SAMHSA and the CDC have really great, resources and really great statistics if anybody's interested in learning more, especially about those suicide rates, because I know sometimes it can be more insightful just to go and just do some research on that. So those are just some places I'd point people to. But definitely just being aware of what's in your local area is always really important. Even if this is not something that's impacting you right now, it could be in the future.
Awesome. That's perfect. We will link all those in the show notes. So thank you again, Meg.
Thank you so much.
Thank you guys. Thanks for having me.